All right, get ready because we're diving deep into FRCS ophthalmology exams today.
Ooh, exciting.
You've given us a really amazing set of materials.
Yeah.
Official documents, practice questions, even these recommended reading lists. It seems like you're serious about getting a handle on these qualifications.
Yeah, it's really inspiring to see that kind of commitment.
Thanks.
To really understanding what these qualifications actually mean.
Yeah.
So you're aiming to be a fellow of the Royal College of Surgeons.
That's right.
That's fantastic. And passing these FRCS exams, that's how you get there.
Exactly.
It's your ticket to that goal, and you also get recognized by the GMC. So
it's a huge accomplishment.
Oh, absolutely.
Passing means like you're considered a competent general ophthalmologist,
right,
ready to manage patients independently.
Yes, yep.
But here's the thing. Even though the syllabus, it pulls from all this subspecialty expertise,
right,
the exams, they aren't actually about testing, deep knowledge of all those specific subspecialties.
Yeah, you got it.
Okay.
The focus is on having that really solid understanding of ophthalmology as a whole.
Okay.
Think of it as a well-rounded, foundation before you maybe go into a subspecialty.
Makes sense.
Yeah.
Okay, so let's break down how these exams are actually structured.
Okay.
There are 3 parts, and they kind of build on each other.
Okay.
You have to pass each one, in order.
All right, makes sense.
So first up, part 1, written multiple choice.
Okay.
Focusing on basic sciences.
The building blocks.
Yeah, like anatomy, physiology, pharmacology.
Put you back to your hands. You got to know it.
But it's not just memorizing, dry facts. Right?
Oh, absolutely not. No.
Okay.
Imagine yourself diagnosing a patient.
Yeah.
You need to know how all of this basic science actually applies in the real world.
So you're connecting the dots.
Exactly. Yeah.
Gotcha.
So then you go on to part 2.
Okay.
That's another written multiple choice exam.
Uh-huh.
This one covers ophthalmic medicine and surgery.
Okay.
Plus, you got to know the relevant bits of general medicine.
Right.
And neurology.
Wow.
And don't forget those medical emergencies.
Oh, yeah.
You got to know what to do with those two.
That sounds intense.
It does cover a lot of ground.
Yeah.
But, if you think about it as a general ophthalmologist,
yeah,
you got to be ready for anything, right?
That makes sense.
All kinds of situations. So, and then finally there's the big one, part 3.
Okay.
The big kahuna.
Part 3.
This one has 2 sections, structured oral exams. They're covering all the different subspecialties and clinical exams where you actually get to examine real patients.
Wow.
So this is where all that knowledge, that you've been building,
yeah,
it all gets put to the test in a real world setting.
Right.
Interacting with patients.
Yeah.
Applying your clinical skills, thinking on your feet.
That sounds like a challenge, but also really rewarding.
Oh, it is. It is. It's the culmination of all your hard work and dedication.
I bet. So let's talk eligibility.
Okay.
Because there are specific requirements for each part of the exam to even be able to take it.
Yeah, you need a primary medical qualification that's recognized by the GNC for Part 1.
Okay.
Building on that existing medical foundation.
Right, and at least 2 years of experience post-qualification.
That's right.
One of which being your internship.
Yep, internship or pre-registration training, that's right.
Yeah.
It's about making sure you have that baseline clinical experience before you even get to these specialized exams.
Okay, so Part 2, the requirements, they ramp up a little bit.
They do, yeah.
You still need that same primary medical qualification.
Of course.
But you also need to have passed Part 1.
Right.
Or have an exemption from it.
Right.
And you also need at least 6 years of experience.
Post-qualification, yeah.
Which includes the internship and then 4.5 years in ophthalmology-specific roles.
Exactly, yeah.
Wow.
They really want to see that you've truly immersed yourself in the field.
Wow, that's a long time.
Yeah, 4.5 years of specialized experience. That makes a huge difference.
Yeah, so it's not just about ticking the boxes.
No. Yeah.
It's about, proving you have the experience to back it up.
Exactly.
What about Part 3?
Part 3, it's all about proving you've really got what it takes to be a fully fledged ophthalmologist.
Yeah.
You have to have passed both Part 1 and Part 2.
Okay.
Or have those valid exemptions for both.
Gotcha.
And you have to have met those clinical experience requirement for Part 2.
Even with an exemption?
Even if you had an exemption for the exam itself.
Wow.
Yeah, again, they're looking for well-rounded ophthalmologists with real-world experience.
Right. It's not just about the exams. It's about, building up those skills.
Absolutely.
And the judgment.
Yeah, judgment, that's key.
To be able to, really do well in the field.
It is.
So, I know that preparing for these exams and taking them, it can feel really daunting.
It's a big undertaking for sure. But the good news is the college, they provide a very clear pathway.
Okay.
And we're here to help you navigate it. So
I'm curious, like what's one thing that you wish you had known before starting this whole journey?
That's a good question.
Yeah.
I wish I had known that it's okay to ask for help.
Really?
Yeah, there are so many resources out there, from mentors to study groups to even the college itself.
Okay.
Don't be afraid to reach out.
Right.
Connect with others,
Right.
Who have been through this process before.
Okay. Yeah, that makes sense.
Yeah.
That's great advice.
Yeah.
So speaking of resources, let's get into some of the specifics of the
Okay.
exams themselves.
Okay, yeah.
Starting with a sneak peek at some sample questions.
Sounds good. Let's do it.
Okay, you ready?
Absolutely.
Okay, this is a Part 1 MCQ example. Which one of the following statements is most accurate in relation to tear? A basal tear secretion from the lacrimal gland is 2.2 oimen. BIE is the main immunoglobulin. C, the aqueous layer is 50% of the tear film. D, the lipid oily layer is 1¼ meters thick. E, the pH is slightly acidic. What do you think?
Well, the correct answer is A,
Uh-huh.
basal tear secretion from the lacrimal gland is indeed 2.2 oimen.
Wow.
This question's a great example of how Part 1 tests, that real foundational knowledge.
Okay, so it's not just about rote memorization.
No.
But understanding those basics, in a clinical context.
Yeah, building those connections between, the theory and the practice.
Gotcha.
Yeah.
Okay, ready for a Part 2 question?
Hit me with it.
Okay, listen closely. In a patient with type 2 diabetes mellitus, diabetic macular edema has been observed. What is the major risk factor for the progression of maculopathy? A, anemia. B, hypercholesterolemia. C, hypertension. D, obesity. E, smoking.
A classic Part 2 question.
Yeah.
The correct answer is C, hypertension.
Okay, so this question is getting at that connection between
Right.
systemic conditions and their impact on eye health.
Yeah, it's not enough to just know about, eye conditions by themselves.
Right.
You really got to understand how they relate to the bigger picture of the patient's overall health.
Right. So if you see a patient with diabetic maculopathy,
Right.
you understanding the role of hypertension in that progression
Exactly.
is really important.
Yeah, you got to be able to connect those dots.
You got to connect those dots.
That's a great example.
Yeah.
Highlights how these exams are designed to really assess your ability to, apply that knowledge in real-world clinical scenarios.
Right. And what can you tell us about the importance of practical experience?
Oh, it is absolutely essential.
Okay.
It's not enough to just bury yourself in the textbooks.
Okay.
Observing seasoned ophthalmologists, practicing your clinical skills, that's what's really going to prepare you for the challenges of these exams,
Right.
especially Part 3.
Especially Part 3.
The real deal.
Now, the college does offer a recommended reading list, though.
They do, yeah.
Okay.
And it's a fantastic resource. So for Parts 1 and 2,
Yeah.
Clinical Anatomy of the Eye by Snell and Lemp,
Okay.
that's a must-read.
A must read.
For Physiology, Adverse Physiology of the Eye by Levin and Adler.
Okay.
That's a great choice.
Okay, and those books give you a solid foundation for studying.
Exactly.
What about for Part 3?
Part 3, Kansky's Clinical Ophthalmology, a systematic approach by Salmon.
Okay.
It's like the ophthalmologist's Bible.
Wow.
It really provides a comprehensive, systematic approach, and it's going to help you navigate, all the complexities of the field.
So there are great resources out there to help you prepare.
Yeah.
But that real world experience is still key.
Absolutely. It's one thing to read about a condition, but it's another to actually see it and manage it in a clinical setting.
Right.
It's completely different.
Makes a lot of sense.
Yeah.
And of course staying up to date with the latest research is important too.
Oh yeah, absolutely. The field of ophthalmology, it's constantly evolving.
Yeah.
Continuous learning is essential.
Right.
You don't want to be caught off guard by new developments or new treatment approaches.
So true.
Yeah,
All right. Well, we've covered a lot of ground in this first part of our deep dive.
we have.
We've talked about the structure of the exams,
Yep.
eligibility requirements, and we've even gotten a sneak peek at some sample questions.
We've explored those, building blocks of ophthalmology knowledge,
Yeah.
the importance of that clinical experience and all the resources that are available to support you on this journey.
Awesome. Well, we're going to take a quick break here.
Okay.
And when we come back, we'll delve deeper into the application process.
Right.
Talk about reasonable adjustments and what it actually means to be a member or a fellow of the Royal College of Surgeons of Glasgow.
Sounds good.
Stay with us.
We'll be right back.
Welcome back to our deep dive into the FRCS ophthalmology exams. Before the break, we were talking about the structure and eligibility requirements. Now let's shift gears and talk about what happens after you've determined that you meet all those qualifications.
So you're ready to tackle that application process?
Yeah, it's time to apply.
The good news is it's all online.
Oh, that's good.
Which makes things, a lot smoother.
Yeah, I know a lot of these professional exams can have like really complicated application processes.
Oh, right.
So that's good that it's streamlined.
Yeah, the college has definitely made things easier. So for Parts 1 and 2 applications, they're accepted on a first-come, first-served basis.
Okay, so get those applications in.
Yeah, don't wait till the last minute.
What about Part 3?
Part of 3 that has a specific window when applications are open.
Okay.
The college, they'll announce those dates on their website.
Gotcha.
So keep an eye out for those announcements.
So yeah, being organized and staying on top of deadlines is really important.
Absolutely.
For sure.
No matter what part you're applying for, though,
yeah,
you're going to need to submit supporting documents
to
prove you meet the eligibility criteria.
Okay.
They'll want to see, things like your medical degree, proof of your internship, and evidence of all of your ophthalmology experience.
So it's all about making sure you're the real deal.
Exactly, yeah.
And of course there are, fees involved.
Right. The college website, it has all the details about the current fees for each part of the exam.
Okay.
It's an investment in your career. And, those fees, they help support the college.
Okay.
All the work they do to advance the field.
Right. So speaking of support, let's circle back to those reasonable adjustments we mentioned earlier. If you have a disability or a learning difficulty, the college is committed to making those exams accessible to you.
They are. Yeah, they want to make sure that everyone has a fair shot at these exams.
That's awesome.
It's very admirable.
So how does that process work?
You'll need to let the college know about your needs in writing.
Okay.
When you apply.
Okay.
Or as soon as you can if your disability is recent. And they'll ask for some evidence, to back up your request.
That makes sense.
They want to make sure that any adjustments they make, are genuinely necessary and fair to everyone. So, for example, if you have dyslexia, you'll need a full report from an educational psychologist.
Wow.
They are thorough, but it's all about, creating that level playing field.
Okay, so what kind of reasonable adjustments can someone expect?
Well, it really depends on the specific disability.
Okay.
And what part of the exam you're taking. So
okay.
For the written exams, Parts 1 and 2, you might be able to get extra time to complete the exam.
Okay.
They can also make adjustments to the format of the exam materials, too.
Like what kind of format adjustments?
Well, they can provide materials in a dyslexia-friendly font.
Oh.
Or on colored paper.
Oh, okay.
Things like that for Part 3.
Yeah.
Which, that has those oral and clinical components.
Right.
The adjustments, they might be a bit different.
How so?
They might inform the examiners about your needs.
Right.
So they can be, mindful of your situation during the exam.
Right.
And of course, if you have mobility issues, they'll do everything they can to make sure that you can access the exam rooms and facilities without any problems.
That's good. It's good to hear that they're so accommodating.
Yeah, it is.
So you've met the eligibility criteria.
Okay.
You've applied. You've sorted out any reasonable adjustments.
Right. You're all set. But what if something comes up, and you need to withdraw from the exam? Yeah, life happens, right?
Yeah.
So if you withdraw in writing before the application deadline, you can usually get a refund.
Okay.
But they will keep a 20% administrative fee.
That seems reasonable.
Yeah.
What about after the deadline?
Things get a bit trickier then.
Oh.
Refunds aren't usually given after the deadline.
Okay.
But, there are exceptions.
Okay.
If something, extraordinary comes up, like a sudden illness or a family emergency, you can submit a request for a refund with evidence of your situation.
But you have to do that with this 30 days of the exam starting, right?
You do, yeah. Those deadlines again.
So many deadlines.
The college wants to be fair, but they also need to manage things efficiently.
Right. Of course. It's about being organized and proactive.
Exactly.
Okay, so we've talked a lot about the exams themselves.
Right.
But let's shift gears a bit and talk about what it means to be a member or a fellow of the Royal College of Surgeons of Glasgow.
Yeah.
What are the differences and what are the benefits?
Okay, so passing Parts 1 and 2 of the FRCS ophthalmology exam,
that
doesn't automatically make you a member.
Okay.
You actually have to be formally elected as a member.
Okay, so there are a few extra steps involved.
There are, yeah, and you have to formally apply for membership, too.
Okay, so what does that process look like?
So once the Director of Education and Assessment
Okay.
confirms the list of successful candidates for Parts 1 and 2,
Yeah.
that acts as your official election to the college.
Gotcha.
Then you'll get an invitation
Okay.
to proceed with the formal admission process.
So you pass the exams, you get elected, then what?
Then comes the paperwork.
Oh, paperwork.
You'll get to fill out some forms,
Okay.
agree to the college's rule and regulations, and of course, pay a joining fee.
The other fee.
It might seem like a lot,
Okay.
but, becoming a member of this prestigious college,
Yeah.
it is a significant achievement
Yeah.
and an investment in your career. So,
All right, I see your point.
Yeah.
So once you've submitted all that, the paperwork and the fees,
Yeah.
what happens next?
the college will send you your official diploma of membership.
Oh, wow.
It's a tangible representation of all your hard work.
I bet.
Yeah, you'll also get a welcome pack
Oh, nice.
with information about being a member.
That must feel really good, like to actually receive that diploma.
It's a real moment of pride.
I bet.
And let's not forget the diploma ceremony.
Oh, yeah, right.
That's a chance to dress up
Right.
and officially be welcomed into the Royal College of Surgeons of Glasgow.
That's awesome. What a special way to like celebrate all that hard work.
Yeah, it is.
But becoming a member, that's just the beginning, right?
You're right. You have to maintain that membership.
Right. So how do you do that?
To maintain your membership, you'll need to pay annual subscription fees.
Okay.
Think of it as a way to support the college
Okay.
and stay connected to this, incredible community of ophthalmologists.
Right. All right. That makes sense.
Yeah.
So now let's say you've conquered all three parts of the FRCS exam.
Okay.
You've become a member
Yes.
and you're ready for the next level fellowship.
Yeah.
What's involved in reaching that milestone?
So fellowship, that's like the ultimate recognition
Okay.
of your expertise as an ophthalmologist.
Right.
The process is very similar to becoming a member.
Okay.
So once you've passed Part 3,
Yeah.
you'll need to be formally elected as a fellow,
Right.
pay a joining fee, and complete the necessary paperwork.
And just like with membership, there are those annual subscription fees
Right.
to maintain that fellowship. But I imagine like the benefits outweigh those costs.
Oh, they do, yeah.
What are some of the benefits?
Well, you'll have access to a vast network of like-minded professionals,
Okay.
tons of resources and educational opportunities,
Right.
and the chance to really make a difference in the field of ophthalmology.
That's fantastic.
Yeah.
So it sounds like being a member or a fellow of the Royal College of Surgeons of Glasgow really opens up like a world of possibilities.
It does, yeah. It's not just about, the letters after your name.
Yeah.
It's about being part of a community
Yeah.
that's dedicated to advancing the field of ophthalmology
Right.
and improving patient care.
For sure.
So-
We've covered a lot of ground in this second part of our deep dive.
We have.
We've delved into the application process,
Yeah.
talked about reasonable adjustments, and explored what it means to be a member or a fellow of the Royal College of Surgeons of Glasgow.
We've unpacked those practical steps
Yeah, yeah.
involved in pursuing these prestigious qualifications.
Right?
And we've highlighted the benefits
Yeah.
and the opportunities that come with achieving them.
Awesome. Well, we're going to take another quick break.
Okay.
And when we come back,
Yeah.
we'll wrap things up with some final thoughts and advice for you
Sounds good.
as you embark on this incredible journey. And we're back for the final part of our deep dive into the FRCS ophthalmology exams. We've covered so much about these qualifications.
Yeah, we really have.
From the structure and eligibility to the application process
Mm-hmm.
and the benefits of being a member or a fellow
Yeah, a lot of information.
of the Royal College of Surgeons of Glasgow.
It has been a journey.
It really has.
But information is only powerful if you know what to do with it.
Right.
So let's try to distill some key takeaways.
Okay.
And practical tips to help you on your path to becoming a fellow.
Absolutely. Let's turn all the knowledge into actionable advice.
Yeah.
First and foremost, planning is key.
Planning is key, these exams. It's a marathon, not a sprint.
Right.
You really need to map out your study schedule,
Okay.
taking those eligibility timelines into account.
Right.
Remember, for Part 2,
Yeah.
you'll need 4.5 years of ophthalmology experience.
That's a long time.
It is. So factor that into your plan.
That's a great point. Don't underestimate the importance of consistent effort over time.
Right.
This isn't something you can just cram for the night before.
No, absolutely not.
So, and speaking of making things count.
Yeah.
What about, utilizing all the resources that are available. I mean, we talked about the college's recommended reading list.
Right.
But there's so much more out there.
There is. Yeah, absolutely. Reach out to mentors, connect with other ophthalmologists, join study groups.
Okay.
Building that strong support network is crucial.
Yeah, I imagine those connections can make a huge difference.
They do, yeah.
Especially when you're, facing challenges or feeling overwhelmed.
Exactly. And remember, the college itself is a fantastic resource.
They are.
They genuinely want you to succeed.
That's great.
So if you have any questions or concerns, don't hesitate to reach out to them.
Okay.
They're there to provide guidance and support.
Okay.
Every step of the way.
That's awesome.
Yeah.
So now let's talk about something that's not explicitly covered in the materials, but it's incredibly important. Mindset.
Yes, mindset. It's often overlooked.
Right.
But it plays a huge role in your success.
These exams, they're challenging.
They are.
Intellectually and emotionally.
Yeah.
There will be times when you doubt yourself, you feel frustrated, maybe even like a little scared.
Oh, absolutely. Those feelings are completely normal.
Yeah.
Everyone experiences them.
Right.
At some point during this journey.
For sure.
The key is to not let those feelings derail you.
So how do you stay mentally strong and focused?
That's a good question.
What advice would you give to someone who's preparing for these exams?
I would say first and foremost.
Okay.
Find healthy ways to manage your stress.
Okay.
Figure out what works for you.
Okay.
Whether it's meditation, exercise, spending time with loved ones, listening to music.
Right. Those are all great things.
Whatever it is, just find what works for you.
Yeah, taking care of your mental well-being is just as important as studying the material.
Absolutely. And remember, you're not alone in this.
Right.
There's a whole community of ophthalmologists who have been through this process.
Right.
Connect with them.
Yeah.
Share your experiences and learn from their journeys.
Yeah, that sense of community can be so powerful.
It is.
Especially when you're facing a challenge as demanding as these exams.
Right.
So as we wrap up this deep dive, I want to leave you with a thought-provoking question.
Okay, I like it.
What do you believe is the most rewarding aspect of pursuing this prestigious qualification?
Oh, that's a great question.
Yeah.
Is it that personal satisfaction of achieving a difficult goal?
Yeah.
Is it the opportunity to contribute to the advancement of ophthalmology? Mm-hmm. Or maybe it's the chance to really make a tangible difference in the lives of your patients?
That's a good question.
It is something to think about, as you navigate this challenging yet ultimately fulfilling path.
Absolutely. And we have no doubt that you have the potential to achieve great things in ophthalmology.
You do.
So we've reached the end of our deep dive. We hope this exploration has been insightful and helpful as you embark on this incredible journey towards becoming a fellow of the Royal College of Surgeons.
Best of luck.
Yes, best of luck. We're excited to see what you accomplish.
We are. GCA Shy.